Hi, everybody. Great. Hello, everyone. We've got a lot of people still joining in here. It should work that as you're entering the meeting and seeing everybody that you'll all be on mute, just to manage any background noise. And we'll have some time at the end here to open it up for the audience to share questions, and we'll use the hand raise function. We can talk about that kind of towards the end. Also, just a note, and if you didn't see this in the waiting room, that we are recording this. So if you choose not to share your profile or want to be on video, you can turn that off in the lower, right down in the kind of the dashboard. Yeah, and I think that is it. Let's get started because we've got a lot to cover. I just want to welcome everybody here. I'm Jessica. I sit on the marketing team.
I have 60 days.
That we've got everybody on mute. Hang on a second.
I'm doing 60 days of furlough.
Hang on, bear with me 1 second. I'm going to make sure that get you guys. Meg, Dr. Doshi, I'll make sure. Kim, Susie. There we go. Meg, give me a hey, Meg.
Hey.
Okay. Dr. Doshi, I can hear you. Susie, can I hear you?
Yep.
Kim, you there?
Hello.
Great. And Michelle? Great. Okay. I think everybody, great. All right. Thank you for technology. Really big group here today. So again, I'm Jessica. I sit on our marketing team at Mamava. I manage our partnerships and our mom community. And this is our second Words of Support. And we're really excited to have everybody here. And we're excited to have joining us three experts in the medical field, healthcare field, maternal mental health. I'll let them introduce themselves in a second. But we are here talking today about breastfeeding in the age of coronavirus. And we had some amazing questions come through from so many of you, covering everything from just the general safety of breastfeeding right now during the newness of this all. Lots of questions about the benefits of breast milk right now, the antibodies that are passed through, just taking general precautions and protections. What does that look like if you're breastfeeding or pumping as a healthcare worker, or if you're just pumping? And then lots of just, general breastfeeding questions that Kim and Michelle can field for us. So as we are talking through and our experts are sharing with us, feel free to use the chat function. Meg and Susie are behind the scenes, but they will be managing the chat function. And if you have any questions, we'll do our best to answer them in a relevant time. If we don't get to them right away on the topic, we'll use that last kind of 10 to 15 minutes to address them and open it up to participation. So yeah, I want to introduce our guests. Dr. Doshi, I want to give a little hello and background of you.
Sure. Hey, everybody. I'm Dr. Doshi. I'm a neonatologist and pediatrician now for almost 20 years. I'm a medical director in several NICUs here in Texas. And I work with Kim and Michelle both, who are without doubt probably two of the most wonderful lactation consultants around, and they've helped a lot of moms here in Southeast Texas.
Great, thank you. Kim, thanks for joining us.
Yes, thank you.
A little intro.
Yeah, my name is Kim Hamm. I've been a NICU nurse for 8 years, and in the last 6 years I've done lactation. I really enjoy just helping moms, and it warms my heart to see all of you join us today.
Michelle. Thanks,
Hi,
Kim.
I'm Michelle. Hi, I'm Michelle. I've been a NICU nurse for 18 years, lactation for 5, and just helping new moms and older moms or experienced moms with breastfeeding has just been a joy. So glad to have you guys on.
Great, thank you. Well, I thought that we would kick this off. You know, the reason that we felt like this was an important area to cover with experts too is there just with the newness of coronavirus and the newness in all aspects of our life and us adapting. There's a lot of information out there flying around. And you know, bringing experts together to kind of validate what is the most current research and the best practices and what are the guidelines that we should be following. And I want to open that up to Dr. Doshi, kind of sharing what is most current, what should we be referring, what resources should we be referring to. Yeah, so you want to frame that up for us, Dr. Doshi?
Sure, Jessica, thank you. You know, there's a lot of research out there, and between the World Health Organization, the CDC, the American Academy of Pediatrics, a lot of these recommendations are changing sometimes daily. New research is coming out daily as well, so it's really hard to keep up, but we'll try to digest everything and try to simplify it for everyone as much as possible. Really, you know, before all of this, the World Health Organization, the American Academy of Pediatrics recommends exclusive breastfeeding up until at least 6 months of age, and then thereafter, at least until the infant's 1 with additional supplemental foods, and that hasn't changed. The WHO and other parts of the world will say, you know, continue breastfeeding until 2 or past that, and you know, as long as the mom feels comfortable with it. So none of that has changed. The main focus now with coronavirus is simply proper hygiene. And then there's a lot of caveats to that, and we can go through all the different questions that people have, but as long as you can do it in a clean or sterile fashion, as you know, as best as you can, that's really going to be the most important thing. Breast milk, breastfeeding is still going to be the safest thing for your baby. And then certain parts of the world where your resources are limited, that may be your only option. So.
Great. Thank you. Yeah, and for anyone that, thanks, Dr. Doshi, for anyone that's just joining and jumped in, just a quick grounding that we're going to be covering breastfeeding in the age of coronavirus. So a lot of questions that came through, like Dr. Doshi was just saying, was around hygiene and around safety, the safety of breastfeeding. You know, if mom is positive, if baby is positive, should we continue? What does that look like? We're going to cover, you know, the benefits and antibodies in breast milk right now. Again, should we continue? What does breast milk look like if mom is positive or baby is positive? There were lots of nuances just based on everybody's personal circumstances, the age of their baby, a lot of the same but different, really different questions. So let's get into like really the meat of that. Like I said, I'll kind of let Kim and Michelle cover really the safety. Is it safe? Why don't we just tackle that question first? Is it safe to be breastfeeding during this time or with coronavirus if you're tested positive or your baby is?
Yes, I think that question probably comes up the most. Is it safe to breastfeed? And the answer is yes, absolutely. This time, there's no reason to believe that it's not. We, like Dr. Doshi said, the World Health Organization, the CDC, they both recommend moms who are sick and choose to direct breastfeed that they're able to do so and should be supported to do so. You know, if the mom is sick and she's not able to breastfeed, say that she's in ICU, sedated or ventilated, in those cases, then she should be supported to be able to continue pumping.
That's great. Can I just ask a follow-up question on that? Because there was a question that came through, just a what if question. If I was intubated or if I was sedated, what does patient self-advocacy look like? How, if you're not prepared enough to, you know, if you have to enter a health care facility for some kind of for treatment like that, what's the plan? Like, who's your self-care advocate? or who is your advocate as a patient?
Yeah, I think that starts with your support person, you know, whether that be your husband, your friend, your partner, that they know what your wishes are. And then from there, if you can't voice those concerns, they can voice those concerns to the doctor, to that team that's taking care of you, and go from there.
Right. Kind of like a birth plan.
Yeah.
Maybe. Yeah.
You can have a breastfeeding plan, but
Right.
you know, you can have your support persons reach out to someone at the hospital, whether it's your nurse, you know, mom's nurse, or most hospitals always have a patient representative or a patient advocate, and speak to them, you know, ask for a meeting, and then talk to them and just see what they can provide. Unfortunately, with the resources that we have currently, some hospitals may have more resources, some hospitals may have less. So that is something to kind of consider with your plan, is to make sure that whatever plan we do is going to be in the best interest of of everyone, and also with the resources that are available.
And I feel like most ICU nurses or ER nurses are going to, ER or ICU, are going to reach out to the mother baby floor if you come in post delivery and at home. And so they're going to reach out to their resources as well if they don't know what to do.
Okay. Yeah. So as far as maternal health care right now in the hospital, I mean, those healthcare workers in that space are prepared. They're right now, they're trained. I mean, because there are moms who are obviously delivering babies. They're having babies right now. And some are coming in and perhaps they are testing positive already coming into delivery. So how many, or is there much information or cases of babies testing positive for coronavirus?
So currently, there has not been a single case that's been documented where a baby was positive right after delivery, meaning mom was pregnant, mom happened to be positive, and then the baby got infected from mom while the baby was still inside. Now, the difference though is, you know, do we see babies, or do we see young children who become positive? Yes, and the risk is that once a baby's out, they're doing skin to skin, they're breastfeeding with mom, and this goes back to hygiene. Is if we're, you know, using proper hygiene for mom, those babies could become positive because mom's coughing on them, and viruses are being shed into the environment the baby's breathing in. So there's certain precautions that you can take, you know, when you're breastfeeding, and this applies to anyone, whether you are either positive or whether you think you may be coming down with something, you're a PUI or person under suspicion. You know, make sure you clean yourself properly, your hands, your breasts, and then also if you feel symptoms coming on and you want to breastfeed, and this is your individual choice, you want to breastfeed, then make sure that you wear a mask. Some people have asked, you know, should the baby wear a mask? Well, no. It's going to make it really hard to breastfeed. But if the mom can wear a mask, that's great. If you simply want to give the breast milk to your baby, have yourself, you know, make sure you clean, sterilize your equipment, pump that breast milk, and then have someone else in the family, or maybe your nurse, give that milk to the baby through a bottle if you're okay with that. And that way, what it does is it limits your exposure to the baby, but you're still providing all the benefits of the breast milk.
Yeah. Just a nuanced question, because one came through who was a healthcare worker, and she's still breastfeeding and pumping, but she asked about, should she absolutely be wearing a mask? You know, your recommendation is that if you're feeling symptoms coming on, or if you feel comfortable and you want to wear one as a non-healthcare worker, but should healthcare workers that are breastfeeding and pumping be wearing masks?
So I have our employees that are pumping. If they're pumping here at the hospital, I do have them wearing a mask while they're pumping, especially if they're with our COVID-19 patients or our suspected ones. But in general, it's really up to you on whether you feel comfortable with it or not wearing it. Mainly just hygiene, like Dr. Doshi said, washing your hands, washing your breast, cleaning the pump pieces really well. Anything that touches the breast milk should be washed.
Okay. Is there really a difference, like right now, should we be considering a difference between washing the parts, our pump parts really well and sanitizing them? I mean, is that just really good washing practices?
The CDC's recommendation on that hasn't changed. Prior to this, the CDC recommended if your baby was in the NICU, once a day you could use a steam bag, where that, kills 99.9% of bacteria and viruses, or, a steamer. So those recommendations haven't changed. When they're talking about cleaning your pump parts, we don't recommend washing them in your kitchen sink or your sink in the hospital. You need to have a separate basin that's designated for, infant feeding items. So you wash in there with warm soapy water. I use a bottle brush and then let them air dry on their own clean area, and then they need to be stored in an airtight. So those recommendations from the CDC have not changed.
Okay, great. We probably covered this, or I think we generally answered it, but is there any research right now that COVID can be transmitted through breast milk? Sounds like no.
No, there's not. We have yet to find COVID-19 virus in breast milk samples or even amniotic fluid samples.
Okay.
That's not to say that it couldn't theoretically happen, but so far we haven't been able to detect it.
Okay. And so I mentioned earlier that there were lots of nuanced questions that came through just based on people's individual or personal circumstance of baby's age. There really isn't, there are questions of, does this recommendation vary for my babies based on a baby's age, or based on if I'm mostly feeding solids and I'm, down to like 2 feedings a day, or it really doesn't. It's still safe at the end of the day.
Still safe.
And we should be doing that. And what about weaning right now? There were definitely some questions on, if moms were planning on weaning, what's the recommendation right now? Just, I think there's a lot of circumstantial factors there. But what would be your recommendation on weaning right now?
Yeah, I think weaning is a personal choice. Just kind of looking at what does breast milk do. We know for the first 6 months of life that it provides all the energy and nutrients. And then even once a baby is two and older, we know that the breast milk provides 1/3 of those energy and nutrients. So I think that, continuing, the baby is definitely getting the benefits, but at the same time, it's also a personal choice that we have to look at the mom's maternal health and other factors as why she's willing or wanting to wean. So that's going to be more individualized.
Okay.
As far as weaning.
Okay. Michelle or Dr. Doshi, you have anything else to share there?
No, it's very individualized, and just, it could be better for mom to wean versus
right.
Versus the baby at this point.
Right. I think some of the questions around weaning were more coming from a place of the benefits of milk right now. And maybe that's a good segue into just kind of honing in on what breast milk benefits and the antibodies that are in them and right now, and how can they really be helping more in protecting us and our immune systems. Do we want to kind of tackle that?
Yeah, I think if the mom is willing to continue breastfeeding the immunity, then I say go for it, because the benefits are there. And when we realize, even if it's that toddler that you were kind of on the fence about, hey, I wanted to wean by the time they were 3, when we look at older kids, we know that, not only the immunity, but the comfort. And I just think about moms right now, we're inside our homes, we're isolated, let's look at all those benefits that maybe for your child, that, your toddler, that just having mom in that comfort versus trying to start a new routine right now, looking at what's going on. It's such a strange time. So
right.
I definitely agree that, the benefits for the immunity, they're there, whether you as the mother had COVID or the baby, we're both going to get some benefits from continuing to breastfeed.
And just that, like you said, Kim, I think just like the routine of it and keeping that normalcy, maintaining that is good comfort too. So weaning aside.
Right. Yeah. I mean, there's obviously those intangible benefits. And I think if you can keep that routine, that will definitely help. Some questions, people have asked her about the antibodies. And so one one thing that we haven't really tested for, or we're still having kind of trouble, is testing for antibodies for COVID, specifically in breast milk. Theoretically, would they be there? Yes. If you were positive and eventually you got better, would that be there? Yes, it sure would. However, we're still kind of working through that research. So if you can breastfeed, the simple answer is, if you can breastfeed, you can continue it, try to continue it for as long as you can, as long as you're able, and then, go from there.
Great. Michelle, did you have anything else to add there? No. Okay. And I just want to remind the audience, please feel free to use the chat if there's anything that we can follow up on, if there's any nuanced questions to follow to the questions that we're fielding right now that are specific to your circumstances. Please go ahead and use the chat. So let's talk just real quickly too. We did cover a little bit about precautions and protection. We had a question again from another healthcare worker. What steps can they really take to create that sterile space if they're going to be pumping in a healthcare facility? What should they be doing?
I would say mainly cleaning the countertops where you're at, cleaning the pump that you're using before you start. We have disinfectant wipes in our room, our lactation room for our employees, so they use it to clean the chair and clean the pumps and clean the countertops. And then just having, once they're pumping into their bottles, they could always pour into a clean, fresh bottle to send home instead of using the bottles that are with their pieces. They could clean those, keep those with their pump pieces, but actually have like clean bottles set aside to pour their milk in. And mainly just cleaning afterwards as well. So cleaning before, cleaning afterwards, just.
Great. And as far as just cleaning, obviously washing hands, but cleaning breasts or anything, or wiping anything down, is that important too? I'm sorry if you did say that.
Yes, no, yes, cleaning breast afterwards. Especially I would clean them before, just because, if they're getting in contact with it at all, just making sure that they're well wiped as well. Great.
I'm just fielding a quick question that came through chat about antibodies, and I'm gonna go ahead and read it. It says, are there IG antibodies in breast milk? I'm not sure what IG antibodies would be, but what specific kind of antibodies are actually in breast milk, if that's even known? Do we know that?
So you can pass antibodies into your breast milk, and the research for right now for coronavirus is still pending. So
okay, great. Let's see here. So cautions around precautions, protection. Looking here, we talked about infants. There hasn't been any documented cases of infants. How high risk? Well, this is a good one for you, Dr. Doshi, being a neonatologist, but how high risk are NICU babies to COVID? And what does that, I think there's a lot of question and fear and interest around, especially moms who are pregnant and going to be giving birth in the coming months, just what that looks like going into labor and delivery, and if you have hopefully not a baby that is in the NICU.
Sure. So a NICU baby is going to be at higher risk for having coronavirus, and I know a lot of people want to try to put a number to that. You're X% higher, or twice as much, or 3 times as much, and no one really knows the answer. We're still collecting lots of data. We're still trying to do those tests, and so we don't really have a true answer. But we do know that certain populations of people are at higher risk for infections. NICU babies for sure qualify. 1, because they're premature. 2, because their immune system is also underdeveloped. And then, you know, a lot of times they have other respiratory problems. You know, they have been on ventilators and can get an infection really easily, or on other devices where their lungs are underdeveloped. So they're obviously going to be at a higher risk. No one really knows how much that higher risk is, though.
Okay.
So we can't put a number to it. Other people that could be at higher risk are, say, you know, your grandparents who maybe have other comorbidities. You know, if they're older, maybe they've had cancer and they're immunocompromised, or transplant patients. And then, you know, that goes back to the question of moms who are pregnant. You know, are they at higher risk for catching COVID-19? And so and here's the difference, and it's a little bit of a nuance, but a pregnant mom who is otherwise healthy has the same risk of catching the virus as a non-pregnant person. However, because you're pregnant and your body has changed, if you catch it, your risk for having worsening symptoms or more severe symptoms may be higher. You know, you've got a baby inside your belly, and your lungs are that much smaller, and you can be more susceptible. Plus, you've got a lot of other changes in your body, so you can be at higher risk for getting worse symptoms.
Thank you. Or Michelle, did you want to add anything?
No.
Okay.
Sorry.
Oh, that's okay. Dr. Doshi, we were talking earlier this week just about, and it interests me, but moms who are going to be giving birth in the coming months, what labor and delivery looks like, what that kind of like division of, I don't want to say it's like the clean and the dirty end of the unit, but like what are those prevention or those precautions and the protections that healthcare facilities and hospitals are taking for moms that are coming into labor and delivery, and then on maternity after, to just mitigate any kind of that, you called it like vertical transmission?
Right. Well, you know, every hospital system is going to be different. But generally what every patient is, anyone that walks into the hospital, whether you're the healthcare worker, you're a mom, you're a support person, you're going to get screened. So, you know, every day when Kim, Michelle, or I walk into a hospital, we get screened for our temperature, for our travel history, any symptoms, and so on. And if we're, you know, positive any of those things, then, you know, there are different things happen for us. We may not be able to even walk into the hospital. Same thing, if you're a pregnant mom and you're coming in, you're going to get those questions at the front door. And then based on that, you'll be put into either a certain kind of room where, you know, you're at a higher risk, and so you're going to have people take extra precautions, or you may go into a regular room and they'll try to separate rooms from kind of the healthier moms versus maybe a mom who's under suspicion, and they will try to separate those. But the key also is the size of the hospital, the resources that the hospital and the community has, and what they can do for that. So,
Great. Michelle, are you seeing anything different or specific in the hospital that you're in now? Or
No, same as that. Same as like Dr. Doshi said, it is you're being screened, and then if you do have the COVID symptoms, then we're going to deliver you in a different area and monitor you in a different section.
Yeah, go ahead.
So the other little difference is that depending on where you are in the United States, if you're in an area like, say, New York City, where there's a lot of the virus going around, you may automatically get tested and screened with a sample and you know, see if you're actually positive or not, even if you're not showing symptoms. But if you're in a part of the country where there's not a lot of prevalence and the virus really isn't, you know, you don't see a lot of cases, then you may not get screened right away, because those smaller areas where the virus isn't may not have enough testing supplies. So that's something to think about as well. And the easiest resource, you know, it goes back to your patient advocate at the hospital, or calling your OB's office, or calling the labor floor at your hospital and asking them these questions before you come.
Right, great. Quick, I'm sorry to bounce back, but I'm just fielding some questions here that we're seeing in chat. One was back, actually was related to the weaning question, but are we seeing, is formula hard to find right now? And I think, yeah, and should that be introduced right now, or just given that maybe it is hard to find? That's some information that's been kind of all over the map too, as far as access to it.
Yeah, I think initially on people were kind of in that panic buying, and we were seeing some shortages.
Yeah.
Currently, I haven't seen that there's been any shortages.
Okay.
At least not in our areas and other parts of the countries. And I can't speak in our area, I haven't.
And with that, they can always reach out to their local WIC department,
right,
and health department with that, and the WIC will be able to provide them with extra resources to get the formula if they were to be on formula.
And do you have to go through application for that, or be qualified? I mean, if you were in a dire position and needed it?
Yes, there is a qualification for it. They may have some different guidelines now, but there is a qualification for it.
Yeah, at least here in Vermont, I know that there has been a rise in accessing WIC for that reason, and for lactation support in general.
Yes, so
being able to get that out.
Sorry, Jessica, but yeah, so WIC does have WIC is usually known for formula, but they do have lactation support. I know here in Texas, the WIC offices are required to have a lactation consultant that they reach out to as well. And so they have that resources for those moms as well. It's not just for formula moms.
Sure.
But a lot of WIC offices are doing like drive-by services to where you don't even get out of your car to fill out those paperworks and things like that. Great.
And telemed, they're doing consultations via Zoom.
Yeah.
Right. There was another question too, another more kind of nuanced, but let's field it. Do babies with A blood type or other specific blood types present a higher risk of contracting or being affected by COVID? Is there any research there that we know of? Not yet.
No. There isn't research right now that conclusively proves one blood type or another is at a higher risk. And some of these, I guess where some people are coming up with this is that maybe there may be one article about one case, and then that starts kind of catching fire and starts spreading. But none of that has been proven where a certain blood type or puts you at a higher risk.
Great. I'm just doing a quick time check. We're at about 3:33 for us on the East Coast. So I want to leave some time to open it up to the audience. There's been some questions that we've been able to field through chat, so thank you. And I think we've covered a lot of the questions that came in through the RSVPs and through everybody joining. So what I'll do is there is a hand raise function in your square where your picture is, that you can click on if you want to ask a question. I've got a few screens going, so I'll scroll through, or I'll be able to see that you've raised your hand and I can unmute you while everybody's fine. And if you have any trouble, please chat us. Susie and Meg behind the scenes there can help point you where it is. Just reading here from a chat comment says, Katie Graves was saying that our local WIC office has WIC breastfeeding peer counselors. So just another benefit of enrolling in WIC if one qualifies, good support in very uncertain times. And WIC, Joanna was also saying that WIC can also provide breast pumps to moms who are qualifying. So good reminder that there's a lot of great resources that WIC is not just for formula, you're right. Wonderful resources for anybody who qualifies. I'm just gonna, let's see, we got Sheena here. I'm gonna lower your hand and unmute you. Hi, Sheena.
Hi, hello.
Hi, welcome.
So my question doesn't have to do with COVID. Is that okay?
That's okay, sure, yeah. Sure.
So I'm a new mom, and my baby is about a month this week. And what I wanted to ask was,
Oh, we lost her.
kind of depleted, like calorically, and I start to get very irritated and kind of emotional. And I was just wondering if anyone knows what that is. It's not during breastfeeding. It's more like afterwards, like I just feel very hungry and almost like I'm functioning at a very low level.
Michelle or Kim, you want to take that?
Yes, it cut off, but I think is what she was saying, and correct me if I'm wrong, that after you nurse, you feel tired, kind of low energy and hungry.
Yeah, and also irritated and kind of snappy, and it's just, I can tell it's happening, and it's I just want to be able to control that a little bit more.
Yeah, that's a common thing. A lot of women actually do experience that. My recommendation is at your pumping area, or I'm sorry, where you're nursing, keep water or some kind of fluid, because part of that could be that you're getting dehydrated. The other part is snacks that are just easy to consume. That could be any, almonds, walnuts, pecans, something that's quick, cheeses, maybe even in like a protein shake, a boost, or just something that's quick that while you're sitting there nursing, you don't have to try to run and cook anything, just some kind of quick snack. Because what that is, it's just a combination of the hormones, and you do become, hungry and thirsty. So keeping those foods right there with you.
And trying to rest as much as possible. Your body releases hormones that make you a little sleepy and a little drowsy, just like the baby. And so just kind of resting when the baby's resting will help boost that as well.
Okay. So basically just eat and drink and rest.
Yep.
Okay.
Key to everything.
Yes.
Thanks,
Thank you.
Sheena. Yeah. Actually, I have a quick follow-up question that came through related to nutrition, but and COVID right now. But is for breastfeeding and pumping moms, is there anything additional that they should be supplementing? Somebody had asked, we're not getting outside as much, obviously, so even more vitamin D deficient than we are. Are there anything nutritionally that we should be adding to our diets as breastfeeding pumping moms?
Speaking on the vitamin D, I do just recommend eating whole foods, but let's be honest, as moms, sometimes we're just doing good to get to the refrigerator to get that meal. And so the AAP, which is the Academy of Pediatrics, and the Academy of Breastfeeding Medicine, they both recommend vitamin D supplementation. So you can either supplement the baby, and that looks like 400 to 800 international units a day of vitamin D, or if the mom chooses to take that supplement, she can take it, and then it's passed through the breast milk, and the recommended dose for the mother is 6,400 international units per day. And the pediatricians, they can probably go to that too, but that's the recommendation from both of those organizations.
Right, that's helpful. That's good.
And just continuing to take your prenatal vitamins. Even throughout your nursing journey, you should really be taking those prenatal vitamins, drinking lots of fluid, good healthy snacks, meals, things like that will help boost that supply.
I see a question here from Taylor Buchanan. I'm gonna lower your hand. Hang on one second. Let me unmute you. Hi, Taylor. Welcome.
Hi. Sorry, I'm actually Jessica. My daughter was using my iPad
Hi,
for
Jessica.
Zoom music classes. So I have my daughter now. She's 22 months, and I just stopped nursing her in December. And I'm actually due May 13th. So I had a question about kind of going into the hospital, because I know you were talking about how moms should be promoted to still breastfeed directly from the breast when they go to the hospital. But I'm in New York, not New York City or anything like that, but a different, smaller part. And I had heard they were talking about separating moms who test positive and like putting the mom and the baby in separate isolations. I just didn't know if you had heard about anything like that, and if you can still do direct breastfeeding then, just because I did have a really good supply with my first daughter, because we just fed on demand and she ate a lot in the first few weeks and stuff, and I just don't want that to like decrease my supply if that happened. I'm not sick right now, but just, you know, in case.
Sure. Yeah, great question.
So the current recommendation right now is, if you are positive, is for mom and baby to be separated. Now, ultimately though, the mom has the right to choose. So that's something, you know, and remember, these are all recommendations. It's not a hard and fast rule. These are kind of guidelines that are out there and that we try to follow as best as we can. So if you feel very strongly about breastfeeding, then what you'll have to speak to the hospital and speak to the patient advocate and see what they can do. But if you are going to breastfeed, then another option for you is to be able to breastfeed with the baby in the room, and then for you to wear a mask.
Okay, so following those precautions that you had said before about just washing everything down, wearing a mask, and all those things.
Right. You know, for a mom who is positive, what they would ideally do is separate mom and baby. But if that's something that the mom doesn't want to do, then mom, use proper hygiene, wear a mask, and then try to keep the baby as far away from you in the room as possible. They say ideally 6 feet, but most hospital rooms are 6 feet, pretty big room. So it's just doing the best that you can.
Okay, thank you.
Thanks, Jessica. One other question, I think we've definitely got some time here. I saw Danielle later. I'm gonna just unmute you. Danielle, there we go. Danielle, are you there?
Hi, can you hear me?
Yeah, we can. Thanks for joining. What's your question?
Thank you. I was just wondering, are women going into the hospital without having COVID or anything, and whether they're tested or not, but they don't have it, and then leaving the hospital with it, so they're catching it there?
We haven't, in our area, we haven't seen that, so that I'm aware of.
Yeah. So, getting COVID through the hospital or a nosocomial acquired, there haven't been any case reports of it, but, the hard part is if you're a healthy mom and you go into the hospital, generally for a delivery, you're going to stay there for 2 days and then you're going to leave. And so if your symptoms aren't showing up until you're 7-10 days out, it's really hard to know if you got it in the hospital from another patient or someone in the hallway or a surface versus somebody else in the community. And that's the hard part to differentiate.
Okay, thank you.
Thanks, Danielle. We have one more here. I thought I saw one just flowing through. Maybe not. Hang on. There was another question. I guess we lost it. It was Emily that I no longer see her on there. There was a question that I don't want to miss. It was just for any infants or babies that are presenting symptoms. What's the recommendation for fever treatment? So infant Tylenol or Motrin, any combo, or is there one over the other that you would recommend if we're presenting symptoms?
So I think the first thing is, to speak with your physician, your pediatrician, your family practitioner. Ideally, it should be Tylenol, especially for a smaller baby, someone under the age of 1, is Tylenol. But if you are suspecting that your child has symptoms and has a fever, before you start giving your baby any kind of medicine, please speak to your physician.
And are there specific symptoms that moms should be looking for in infants or babies? That are they presenting differently?
No, they're presenting really with the same symptoms, but the very first thing that your child's going to have, your baby's going to have, is they're not going to eat good. Before they start having fevers and start having coughs and all these other things, they're probably, the subtle signs are going to be baby's a little bit sleepier, the baby hasn't been breastfeeding as well, and having some irritability. And so, just be really mindful and try to stick to that routine. Like Kim was saying earlier, keep a steady routine in this time, and that should help you be able to catch those symptoms early on.
Yeah, right. Great. Well, I think it's about 3:45 here, and we feel that great questions, really smart. I want to thank Dr. Doshi, Kim, and Michelle for joining us and providing this expertise and guidance. It feels really grounding and important. So I hope that was offered to you and provided you feel good too. We are going, just a quick wrap up, we are going to be producing a blog that will, a blog post highlighting and kind of summarizing the biggest takeaways from this meetup. So I will follow up with everybody that's joined here with a link to that. It'll probably be sometime next week. So you'll have that as a resource. And anything before I close up, Dr. Doshi, Kim, or Michelle, want to
I think
share?
On one of the questions that were filled in before about the latch and just knowing, so just knowing the basics on how a latch should feel and how a latch should look.
Sure.
And so you really want to worry about alignment versus, like, you want the baby's ear, the shoulder, and the hip in a line when you're nursing. You want to make sure that the latch feels comfortable to you. It should never hurt. It may be tender in the beginning, or the first few latches may be a little tender, but after about 10 seconds or so, it should really kind of ease up on that. Making sure the baby's getting enough wet and dirty diapers, that the baby's nursing 8 to 12 times, about 5 to 6 wet diapers a day, 2 to 3 dirty on average. This will make sure that you're maintaining the right base, the right schedule to know that things are going properly. Because moms aren't being able to get into the pediatricians, or may not be able to get a physical hands-on with the lactation consultant. So these are just tips to kind of keep in mind.
Sure.
Kelly Mom is a very good mom website that'll give you a lot of information, just general information for breastfeeding.
Yeah, great. Thank you. And Kim, any closing shares or remarks you want to give?
I just want to remind all the moms, just have grace with yourself during this period. This is new for all of us. We're all first timers with this. So I tell my moms all the time, if all you do is take a shower, it's a good day. So through this too, it's a good day.
Tiny victories, I say, focus on those tiny victories. Yeah. Well, thank you all for joining us. One quick little plug to just follow, if you don't already, follow us on social at Instagram and Facebook for a lot of other resources that Mamava can provide, and sharing your words of support via social. But yeah, look for a blog post coming up next week and recapping this meetup, and hopefully we'll be doing more of these. So thank you, everybody. Have a great afternoon. Bye.
Bye.